welcome again after a long weekend. We haven't met since on Friday. We had a good topic that we learned and we talked about many issues. Today is all Monday after having the weekend. The weekend had very many issues that we couldn't talk about, and it's time today, as per the topic says, we go on talk about somatic and related disorders, somatic and related disorders. So we need to ask our question: what do we know when we say there are some terms that we use in medicine that we need to know what they mean. Hmm? There are some terms that we use in medicine that we need to know what they mean, so that when we are talking about some issues, you are relating with what we are talking about. Now, what is somatic? Hmm? What is somatic? Somatic. You see, somatic is a word that comes from a Greek word called soma, meaning the body. You see, soma meaning the body. Whatever that we talk about in medical terms, most of them come from the forefathers that brought these words up, and the forefathers of medicine mostly, you see, they define what we say and what we talk about. Now, when we talk about somatic and related disorders, so we're talking about the body and related disorders of the body in relation to the mental health. You see, it comes from the Greek word called soma, meaning the body, in medicine and physiological context, generally referring to the body. So when I'm talking about somatic and related disorders, yes, Erica, welcome to the platform. I'm saying you, Erica. If you have not subscribed, please subscribe and like, and we continue with our topic. Yes, now we are talking about somatic and related disorders in relation to medical, mental health, medical. You see, in medicine, somatic cells means all the body cells exception of germ cells. When we're talking of the germ cell, you know what we mean. All the body cells, somatic cells. Somatic cells are body cells. Germ cells are cells of reproduction. You see, now I will talk about the when I will talk about we are talking about somatic cells. The topic says somatic and related symptoms, disorders. You see, you will know we are talking about the body, uh, the body of a human being, because we are talking here about mental health. Now we go on and see what are we saying. Somatic symptom and related disorder. What are these? The somatic symptoms and related disorders are group of mental health and condition characterized by presence of physical symptoms that cause significant distress and impairment but are not fully explained by a medical doctor. Key features is like excessive thoughts or behaviors related to, you see, I repeat so that I know these phrases are sometimes confusing, but I want you to listen carefully about what I'm saying. Somatic symptoms and related disorders are group of mental health conditions characterized by the presence of physical symptoms. You see, it is characterized by the presence of physical symptoms that cause significant stress and impairment, but are not fully explained by a mental condition. Let's have this example here. Maybe someone you know, or your relative, or someone in your family, or someone else who you share with the life, like you live together. This person always complains of stomach aches. Stomach aches always. This person goes to a medical facility, is done x-rays, He's done endoscopies to check whatever that is in the stomach. He's given probiotics, the drugs that can help your stomach. He's given antibiotics. But even after treatment, you find that this person still has the problem. This person believes that I'm still having this problem. These doctors are not telling me the truth. You see, these are the symptoms that we are going to talk about, somatic and related disorders. Now, there are several main types of these somatic type disorders. Like one is somatic symptom disorder. The first one, we call it in short SSD, somatic symptom disorder. The second one, we usually call it illness anxiety disorder, hypochondriasis, illness anxiety disorder, anxious of being ill, hypochondriasis. You see, and then we have the third one. The third one, which is conversion disorder, functional neurological symptom disorder, conversion disorder. And then we have the fourth one, psychological. We will go one by one to each and see how we can manage this and how we can help. We have psychological factors affecting other medical conditions. That is the fourth one. And then we have fictitious disorder. Hmm? Marshall's, we call it Marshall's syndrome. Marshall's syndrome. So when we go back to the first one, which is the main types, you see these are the main types of somatic syndrome disorder. Let's go to the first one, which is SSD. SSD, we've seen, is somatic symptom disorder. So SSD, hmm, what is this? But you remember when I started, I said this is a situation whereby a person believes I'm not okay, even after being treated from second opinion. Very important. But this person will always go for second, third, fifth, seventh, eighth opinion, not believing in all, even if four of the doctors will tell the same thing, this person will still believe related to physical symptoms, which may or not have a medical explanation. The focus is not just physical symptoms themselves, but disappropriate and persistent distress they cause. You see, when you believe that you are not okay and there is something that is disturbing you, and these doctors are not seeing this something, even if they reassure you that you are not okay, you see, there is a problem. Hmm? There is a problem, and it should be checked. How could you know that this person has this problem, the somatic SSD? In short, we call it SSD. You will know this problem in this way. One or more somatic symptoms that are distress or result in significant disruption of daily life. One or more, you see, one or more symptoms that may show that this person is in distress. Excessive thoughts, feelings, or behaviors related to somatic symptoms associated with health, like which ones concerning and manifest at least one of the following, like this one. These are as you come in the platform, please like the video. If you have a question, put it through. If you are not understanding anything, it's good to ask, because you may, by asking, you may be helping someone to reason out or something that someone had forgotten. If you ask, you'll be helping someone. Now, these are the criteria, like disappropriate and persistent thoughts about seriousness of symptom, disappropriation or disappropriate and persistent thoughts about seriousness of the symptom. At times you may find that it's not seriousness. Someone may feel it, this I'm very serious, but this person really is not serious. Persistently high level of anxiety about health or symptoms. He's, a person is very anxious about the health problems and the symptoms that are coming, like headaches always. Some people complain of headaches when they are not even having the headaches. Hmm? It's important to to go and see a doctor when you have headaches, persistent headaches. But there is another thing that when you're feeling you're having the headaches and those headaches are not there. Excessive time and energy devoted to symptoms of health concern. Hmm? You always think about your headache. You always think about, you take time to go to hospitals and do things that are, are always forcing people to help you, and you don't have the symptom that you are saying. Most of it, mostly I've seen, it is pain. Pain is a symptom that people complain a lot of. Headaches, abdominal pain, muscle pain. Hmm? And then we have the third one, like the state of being symptomatic is persistent, typically more than 6 months. Although the specific symptom may change over time. And I say today I have a headache, tomorrow I have an abdominal pain. But you see what we are saying here is this person has persistent symptom that even when you do some tests to find out if the symptom is there, you find the person is okay. So the three things that you matches the criteria is one or more somatic symptoms that are distressing or result in significant disruption of daily life, excessive thoughts, feelings, or behaviors related to somatic or associated health. You get it? Concern as manifested by at least one of the following: disappropriate, disproportionate and persistent thoughts about the seriousness of the symptom, persistently high levels of anxiety about health or symptom, excessive time and energy devoted to symptom or health concern. The state of being symptomatic is persistent within 6 months or more. But you see, these symptoms may even change over time from headache to abdominal to pain in your. Yes. If you ever had someone with these problems, please share. We get to talk and see what did you see, how was the experience, because I'm sure there are some people you've taken to hospital that have these problems. We are in SSD, somatic symptoms and related disorder, the first complication here. The symptoms can be any organ symptoms. You get it? Pain, fatigue, gastrointestinal issues, muscle pain, headaches. You get it? Sometimes some people complain lack of strength to move from bed. Yeah. Sometimes chest pain. Yeah. Common issues when it comes to this somatic symptom related. And I want you to know that there are chronic pain or issues or symptoms that you feel that they are not necessarily displayed scientifically by the doctor's machines or examination physically. Get it? The symptom may or may not have a clear medical cause. You get it? The distressing and impairment and psychological driven. Hmm? The distress and impairment are psychological driven. You are the one who is telling people and showing people how painful you are feeling, but the pain is not there. Not intentionally produced, not malingering or fictitious disorder. You see, the person may frequently visit doctors, undergo tests, and still remain convinced that I have this problem. And this person is not seeing, these doctors are not seeing that I'm having a problem. Hmm? You see, this one is a very important issue when it comes to SSD, somatic symptom related disorder. But you see, a psychological aspect, the patient genuinely feels unwell. Psychologically, this patient genuinely is feeling unwell, and the distress is real. The patient is displaying the discomfort, real. There is often a misinterpretation of body is essential. There is always misinterpretation of bodily sensation. Coexisting conditions like depression and anxiety are common in this. You will find this person has always depression because you are not understanding this person. When this person is saying, I'm feeling pain, you think this person is joking. Hmm? So it is of importance to know how to handle these issues. We will so see how to handle a patient. Now we will go to the second one that we have talked about, hypochondriasis, illness anxiety disorder, hypochondriasis. Have you ever been with a person who has hypochondriasis? How did you find this person? He's always having problems. With certain illnesses. Hmm? You see, it's good to be healthy, and it's another thing to behave like you are always sick and you need help. It's very important to be healthy, but it's good to be genuinely sick. But you see, we have seen in SSD, the first one that we have discussed, we have seen that this person is genuinely sick because this person is heading to depression and at times they have anxiety. And it's important to take care of them because when these people come to hospital, let me give an example of chest pain. You do an x-ray, the chest is okay. Hmm? You assure this person that I'm not giving you any drug, but if you feel pain, I can give you some painkillers. Yes, Majay, hello. Yes, welcome to the platform. Welcome to the platform, Majay. And when you give this person painkillers, he'll still go and say, the doctor did not handle me well. This doctor did not give me pain, did not treat me well. I'm still feeling pain. Hmm? Now, we go to the second one, which is illness anxiety disorder, formerly known as hypochondriasis. It was known as that. What is this one? What is illness anxiety disorder? It's a mental condition marked by preoccupation with having or acquiring a serious illness, despite having too little to no somatic symptoms. The concern persists even medical evaluation and reassurance and non-diagnostic tests. There are some people who will always think they are having a particular problem. These people, even if you tell them, someone will tell you no. You know, my mother had diabetes, and I'm going to the lose of much to micturate. Micturation is a word called how to urinate. We call it in medical terms micturation. So I think I'm having diabetes, or I'm going to have diabetes. Always anxious of having diabetes, and even sometimes they don't like taking starch because they are sure I'm gonna get this. It is called hypochondriasis, illness anxiety disorder. You know, I have a problem with my stomach, so if I take these foods here, I'm sure I'll not be okay because in our family we have issues with. Yes, you have gone to an occasion and you are not. Greetings, beauty, welcome to the platform. We are talking about somatic symptom related disorder. Those people that think they have problems, they are predisposed to problems. So we are in the second one, hypochondriasis. Please catch up if you have a question, ask. You see, you are always anxious of being sick of a particular sickness. It may be diverse, but you see, for you have to look at this person. Not everyone who complains thinking of having a problem has hypochondriasis. No, there are some criteria that someone has to use to know that this person is having a mental problem. One is preoccupation with having or acquiring a serious illness. One, that is the most important. When you come to the second one, or the second is somatic symptoms are mild or not present. You may have that symptom, but no, if present, the concern is clearly disproportionate. You see, when you have some, let me say, most people when they know that they have diabetes, the first thing they feel is thirst and a lot of urination. But you, maybe you went to a party and you drank water a lot or drinks, if soft drinks, and then you go home in the evening, you start urinating a lot. So you can like start being anxious, like, ah, yeah, yeah, no, 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 this must be diabetes. This one must be diabetes. Or at times you get stomach pains. Maybe you ate a lot and you kind like feeling nausea and you vomit. Now you start saying that my mother died of, or my father or my uncle passed on because of stomach cancer. This must be it. Now you start being anxious. You start running to doctors, doing X-rays. Not, and you're the one who did eat a lot. You see, these are hypochondriasis, specific illness anxiety disorder. You are having that disorder. It's good sometimes to live life freely, do exercise, eat, unless you are restricted because of a specific condition. Now, the third one, the third criteria that you may look and see this is heading to that, there is a high level of anxiety about health. There are some people who are so uh, anxious and they are so specific on some things when it comes to health. And an individual is easily alarmed about personal health status. If you tell this person, people that have headaches is associated with this, he'll be so anxious to know the conditions that headaches come with, the conditions that abdomen come with. You've met these people, this is a mental health condition. We need to help these people. Hmm? The individual performs excessive health related behavior, body checks, going to doctors' laboratories every time to know about his body, frequent checks to visitors even if you don't need it, or exhibit maladaptive avoidance, avoiding hospital. Yeah, it is two-way. There are some people like, yeah, Janet Harris, welcome to the platform. Nice to meet you. Today we are talking about those people that complain of specific symptoms, and those symptoms are not there. Hmm? You see, so what this the fourth criteria we have said, it is for you to know that this person has anxiety disorder. You will know in the fourth one is some people when they go near the hospital, their blood pressures rise. Anxiety related illness disorder. Anxiety related illness disorder. Yes, fans. Today I say hi from Jamaican uncle. We had a good time. Yes. I'm sure he'll be on the platform sometime. Yes. As we continue. Illness preoccupation persisted for like 6 months. Imagine 6 months you are complaining that I'm sick and I should be checked. These people are not seeing that I can get cancer. People, when you tell someone cancer, so they start having problems, saying that, yeah, I'm having a problem and these people are not seeing. Hmm? I've seen such patients in my office several times, and I've talked to them. They don't need, some doctors take advantage of doing tests, taking their money for consultation, and drugs. Don't predispose a patient. If you are a doctor and you are looking at me, or a health worker, and you have a facility or a chemist or a what, don't be so into getting money from these patients because you want to gain something. Just talk to this person. Let this person know that he is not sick. Yes. The sixth one, the health anxiety is not better explained by another mental disorder, such as somatic symptom disorder, general anxiety disorder, or OCD. You see, whatever you are complaining cannot be explained by another mental disorder. Hmm? You are always complaining. Those are the criteria that we will know that this person has anxiety illness disorder. When you've worked with your patient several places and this headache is not going away, but at times you feel that the patient may not be having the headache, please look at these 6 things. Preoccupation with having acquiring a serious illness. If someone tells you that I think I'm going to have a cancer or I'm going to have this specific illness and you've been complaining of of a symptom for long, that preoccupation, acquiring a serious illness, somatic symptoms, body symptoms, somatic at body cells are mild or not present. At times they are mild or not present. The concern is clearly disappropriated. There is a high level of anxiety about health. This person is always talking and very specific and critical about health issues, eh? Personal health issues. The third one is this high level of anxiety about health. Yes. The fourth one may be the individual perform excessive health behaviors, body checks, frequent visits to the doctor, or avoiding hospitals at any cost. Mhm. The fifth one is illness pre-application for at least 6 months. If this one goes for at least 6 months or more, you'll know now. The doctors have always reassured, but this person, it's more than 6 months. I think he's suffering a mental issue called anxiety illness disorder. Mhm. The illness is the last one is it may not be associated by any symptom or any complication in from the patient. You yourself, you are seeing this illness that this patient is complaining is not being associated with any illness. Yeah, now, the main features in anxiety illness disorder main focus fear or belief of serious illness, yeah? Somatic symptoms, the body symptoms like pain, rashes, symptoms that you can see like rashes, yes, not seeing well, or swellings, they may not be there or they may be there. Response to reassurance is poor. Even if this person is reassured that you are okay, the response is very poor. Duration is like 6 months or equal to 6 months plus. Common behavior. Those people that will be reassured by the doctor, but they still Google. Finding out about your complication is not okay. It's okay. It's very okay. But your doctor has talked. You know, when we go to medical school, we stay there for years to train on some things that you should not make a mistake when doing a diagnosis. But you see, this is a person that will go to Google for a few minutes and always repeat Googling the same thing. And you know, symptoms are shared within other complication. A complication and other complication may share a symptom called headache. So doctors and health workers are trained to differentiate these symptoms from a particular disorder. So you, as you Google, you are always Googling and checking medical. Those are the behaviors with people that have symptom related disorder. Always Googling. Please, when you visit this doctor and you need a second thought, go to the other doctor, be reassured with the other doctor. If you see 3 or 4 doctors are saying the same thing, rest your case, take the information, and please be reassured that you are okay. But you see psychological profile of these people, eh? They are always having catastrophic interpretations of normal body sensation. When you feel something small, you applaud it. When you see a headache after a very sunny day, you applaud it. After eating a bad meal outside in a hotel, you applaud it and say that is the symptom that I was saying and you are not listening. Low threshold for alarm over minor symptom. You see, cough is interpreted as lung cancer, yet you think like a cough can bring a lung cancer. Raising storms over teacups. People that have anxiety related diseases are diseases. And at times, let me tell you, you may get a flu and be okay without getting any medication. Because let me say, if you get a viral flu, you didn't need medication. You just need an antihistamine if it is worse. Let it go for 4, 7 days. Let the virus take its course, and then you'll be okay because our bodies know how to adapt and fight some viral. And you see, antibiotics may not cure viral flus. So you wait. If there is something you can take to relieve it, like painkillers, like paracetamol, it's okay. But if it is not so worse, why use medication? Why run to doctor? You see, hmm? Wait until you see you are down so that you can run to doctors. We usually always walk here with flus and you are okay. You put on mask not to infect others and you feel good and it comes and goes. You see, psychologically, this can be triggered by hearing about illness in others or in media. When you feel someone, you have a flu and you see there is an outbreak of COVID in Germany, you start running up and down saying that I have COVID. Well, yeah, psychological issues. No, be reassured by your doctor and be okay. Constantly seeking reassurance is a common thing to people that have these problems of somatic symptom disorders. We will see how to manage these problems because most of the management they are the same. When we go to the third one, conversion disorder, functional neurological symptom disorder. Have you ever found someone who has problem with neurological, we talk about the brain. Have you ever found someone with these problems? Please, if you have a question or you're not understanding something, it's better to raise the question. Don't just sit with your question. If you are not understanding, someone else may not be understanding too, and you raise a question and we help each other. Hmm? Conversion disorder is what? What is conversion disorder? Let's talk about conversion disorder. Conversion disorder is a let me see a minute. Conversion disorder is a mental condition in which a person uh, a minute a minute. Yes, Kamil. Yeah. Nani amekuja? What will we do now? Take vitals na mwambie ningoje. Is he sick? Okay, take vitals and come. Yes. In conversion disorder, sorry, it's a client who has come who wanted to see me, but it's let them start doing and then we'll continue. You see, conversion disorder is a mental condition in which a person experiences neurological symptoms such as paralysis, blindness, seizures, or numbness. You see, sometimes you feel paralyzed, sometimes you get blindness and seizures or numbness that cannot be explained by a medical doctor. You see, hmm? These symptoms are intentional, produced, and often in response to psychological trauma. You get, these are symptoms that at times you as a doctor you will not explain, but this person seriously cannot move the leg. But when you do electrocution, the leg is okay. Yes, the leg is okay. Sometimes this person insists that I cannot see. You look at the eye, you examine the eyes, they are okay. You start thinking, what is, eh? People that always get hysteria, you get them faking seizures or getting some seizures that as a doctor, you see, you can't characterize this type of seizure, and they are not epileptic. You see, now, how can we say one or more symptoms of altered voluntary motor or sensation function, weakness, movement abnormalities, or sensation losses? This one, when we talk about sensation losses, this person cannot see, cannot move a hand, or you realize that he maybe is hysteria. We call it conversion disorder. Always called functional neurological symptom disorder. Something when a person is not moving or can't see, we see it is a functional disorder, mental disorder. And clinical findings now here, they are not relating, they are incompatible. You see, a person cannot move the hand, but when you do your test, you do a Doppler's ultrasound on the leg, the veins are okay. You do an electromagnetic fusion test, you all these are same. You do even the echoes of the heart, all these are the same. You start knowing that okay, we are having conversion disorder to this person, and you see these people may stress the society a lot. If you are coming in, please like the video and share. If you are not subscribed, please subscribe. We move on. Mm? Your subscription may help someone when he is listening to me talking, also the other professionals when they start coming in. It will help someone because these are things that people suffer from. Now, the symptom or deficit is not better explained by another medical or mental disorder. There are some things a person is always okay, but this person may always complain that in one morning this person complains, I cannot move my feet, they are numb. Now you call an ambulance, you get to hospital, tests are done, everything is okay. And you see, these are symptoms that will cause distress to the family and to everyone as a whole. mm? Family and everyone as a whole. So what do you do? What do you do? If you have ever met such people, please come in. Tell us if you have experience of these things that I'm talking about. Conversion symptoms, motor function, seeing, paralysis. But I know the common symptoms in this are the ones that I have met in this are like paralysis or weakness of the limbs. A person comes in hospital, is carried by the stretchers. You do your examination, you find that this leg has no problem. You repeat the Doppler's ultrasound like 3 times, and you see this person has no problem. And then you start asking yourself as a doctor, what am I not seeing? What am I not thinking about? But you ask down the line, you get a history of such experience. The same person, several times he has taken to the hospital. Now, what do you do? There is another one called abnormal gait or coordination problem. This person is just walking abnormally. Yeah? Tremors about abnormal movement and tremors, seizures, faking seizures like episodes. Non-epileptic, you're not epileptic but you're having seizure. Mutism, speech loss. Have you ever come around a person when this person is tired or this person does not want to do something? He gets speech loss. You know, you have not organized a speech to go to a function somewhere at work. You have not done ABCD. You fake a very bad flu and then the speech has gone. But you go to a doctor's office, examines your chest, there is no flu, there is no bronchial sounds are well, you are every 100%. Hmm? Those are motor symptoms, mutism. But there is sensory symptoms like loss of touch or pain on sensation. Blindness or double vision, deafness, loss of balance. Sometimes a person may just decide not to listen. You talk and he's looking at you like this. Those are mental issues. Hmm? You see, those are mental issues. Yes. It is very important to know these issues so that at times you do the right diagnosis, and when you do the right diagnosis, what do? You treat these people well. I've been called for let me stabilize the patient, three like a minute or two. I'll be back here. We continue with the two that are remaining. Those that are online, please don't leave. I'll be back soon. Let me see the patient that has been brought in right now. Yes, guys, I'm back. I'm back. I'm back. Sometimes when you're working at the doctor, you get so many alarms. So you go and stabilize. You leave the nurses and the other health workers to stabilize. My office is in the hospital. So every time I'm needed or there is an emergency, I have to rush. That's why I was there. So we continue. We continue. We continue. We are cycle. We continue. Just a reminder. At the functional disorder, functional neurological disorder, and we have talked about complaining, you complaining on how someone can fake paralysis or even not fake the paralysis, but you see this person is still, hey, my tennis guy is in the platform. Hi, I'm here. I'm here. We are talking about. Let me rewind those problems that people, you have seen a person going to hospital and they are really complaining about a specific problem, but contrary to the doctors, they are not seeing that problem. But you, as a patient, you are complaining of it. So we have started up with the first one, which is somatic symptom disorder. We have talked, we have seen what is somatic symptom disorder. We have talked about illness anxiety disorder, the people that are always anxious of having a specific problem. And then we have conversion disorder. Conversion disorder, that is where we are. Disorders concerning paralysis, those people that always say, I have this problem, I've gone to doctors, but they are not helping. They are reassuring you, you don't have a problem, but you are always going back to another doctor. But you see, when these people are not faking it, when you program your brain, you have a problem, you will feel the symptom mentally, psychologically. Like the conversion disorder, we had gone from the first one, which was motor sensations like paralysis, tremors, seizures like episode, and mutism. Mutism is loss of speech. And then we have sensory symptoms like loss of touch or pain sensation. You just lose touch, blindness or double vision, deafness, and loss of balance. Sometimes you don't have balance. And what are the clinical signs, medical signs, or signs that may feel that something is not adding up? Inconsistent findings, e.g., strength normally during distraction but weakness when tested directly. You see, when you go to the hospital, this person knows he is being tested of a particular thing. But when you are home and you abruptly meet this person may be okay. Hmm? Non-anatomical distribution of symptoms. Sometimes you know symptoms are distributed evenly. When you have pain in the stomach, they are the way we look at you and we see the distribution of pain to where it is going. Hmm? Sometimes you may find someone having leg numbness eh, in a stocking pattern. Then you can like look and see, ah, is this really making sense? As a doctor, you still think and you think, is this really making sense? Sudden onset, often after stress or trauma. When you have stress, it comes up. Sudden onset. Hmm? Or when someone hits you from below, you shift that pain from the leg, it becomes the chest pain. You are hit on the leg, but now you start touching your chest, complaining of the chest. Hmm? You see, it's good to at times know how to relate to people, because there are people that divert illnesses when they don't want to illnesses when they don't want to do some things, or they are avoiding legal issues, or they are avoiding to be responsible to some things. You see, when someone has done a mistake, it's better to be responsible of your mistake. So Core neurological features in conversion disorder like paralysis, seizures, blindness are incompatible with medical findings. When you have done some examination, it is not related. Symptoms often follow stress and trauma. When someone is stressed, he starts to complain of the same symptom he complains always. You see, I've explained that. Just imagine a woman sudden getting paralysis in the legs after hearing about her son's accident, but all neurological tests are okay. Your son has got an accident, then you start having paralysis. But when you go to the hospital or you start having uh, difficulty in speech. Hmm? There is the fourth one. We will go to the fourth one. Psychological factors affecting other medical conditions. How? Hmm? Psychological factors that affect other conditions. You see, there are some psychological factors that may affect other conditions, and these ones are medical conditions but are related. Even mental health is a medical condition. Psychological factor affecting other medical condition is a medical diagnosis when psychologically or behavioral factors significantly affect the cause, treatment, outcome of a medical condition. You get it? This condition is classified under somatic symptom related disorder. Like, it is classified under these complications that your psychological factors that affect other medical condition. You have stress because of something, and then your sugar levels rise up or your BPs go up. You get it? All of the following are the criteria that we look at when we see that there are psychological factors that are helping medical condition. Right. Yes, yes, yes. Answering one of you. You- Yes, yeah, there are some cases like diabetes, asthma, and hypertension. When someone is having stress, the BPs rise up. This is, you see, these people are not faking it, because when you do the test, you find that it is the reality. When you do a test when a person is stressed and is sweating and urinating and very thirsty and unconscious, you find that the sugars are high. Hmm? These are the criteria. Psychologically or behavioral factors advise you affecting the medical condition. You should have at least what I'm going to tell you. These points that I'm saying, influencing the cause of the condition. If someone is diabetic, or it, and you're stressing this person, see now this is the reality. This person's sugars go up, interfering with the treatment. Yeah? Someone is under treatment, let's say for TB, and then he has psychological issues. This guy just stops taking medication, and treatment becomes a problem. Hmm? Constituting additional health risk, risky behavior or denial. Denial is a risky behavior when it comes to treatment, mostly when you are under specific management of some bad diseases. When you are in denial, you may stop medical therapy and you may worsen the condition, or you may bring a complication to the doctor on how to manage you. Hmm? Mostly when it comes to wrong use of antibiotics. Resistance of antibiotics is a very bad thing. So, if a person is taking a TB, tuberculosis drugs, and he's in denial and he sees that I will not get well because I'm taking these drugs and they are not helping, and you stop taking as per the regimen, you may bring yourself issues. You may bring yourself issues of resistance, and resistance of TB drugs is a very bad thing. What else will treat you? Hmm? This way may bring more complication, hmm? Constituting additional health risk behavior, denial. It's not good. Influencing the underlying pathophysiology, triggering or worsening the symptom. See, there are some symptoms that are worsened by stress. Headaches when your sugars rise up, dizziness when your BPs are up because of psychological issues. It's really good to tame your impulse reaction to some things when it comes to psychological problems. Mm? The psychological and behavioral factors are not better explained by another mental disease. You are not psych, you are not having a bipolar disease, you are not having any other problem. But when you are having stresses, you get these problems. Common psychological factors are these: denial of illness, the common one. Denial of illness. You see, there are some things you go to this doctor, you are told you are suffering from diabetes. You go to the another one because you have denied, no, this doctor is lying to me. And you see the same illnesses, the doctors use the same criteria to treat you and to make sure that they are not going the wrong direction by telling you that you have this. You go to the other one, this doctor tells you you have diabetes. Yes, but you deny and you stop taking medication. Hmm? I cannot be hypertensive. This doctor is not telling me the truth. What will happen? You are in denial, you are not taking medication. Your BP will go up. And it will go up, and you know the complication of BP going up is end organ damage, stroke, your brain not getting enough oxygen and nutrients. You get a stroke. Please, when you go to the first doctor tells you that you are developing this, and then you go for reassurance to the other doctor, you still get the same information. Please take it as a positive thing, because now they are telling you to start taking care of yourself in a good way so that you may not get a risk of those things that I've talked about, like stroke, kidney related issues, liver related issues. Take your medication. And you know, sometimes these things, when they are acute, when they come faster and they go, you may take the medications and you may be tapered off after some time because the medication have worked. And maybe if you had an acute high rise of sugars because of something else, you may be okay. You may be okay because now you have taken drugs, the sugars have worked, and now it's time for the body now to work properly. But when you are in denial and not taking a medication, you are a problem. You for yourself, you are destroying your body, and your body is the temple of God. No, listen to the doctors, they know more than you because they went to school. You see, non-compliance with treatment. Non-compliance in treatment is a very bad thing. It makes both sectors to have a problem. In this way, let's take an example of the same thing that we are talking about. We are talking about TB. Let's talk about tuberculosis. Let's talk about tuberculosis. When you talk about TB and you're not taking those medications as per needed, if you get resistance, you may give another person TB that is resistant to the bacteria of TB that is resistant to the drug that is being used currently. And then you give someone, the person who has received it will give another person the drug, the same TB. What will happen? That is killing people. You are killing people because the regiment that is there will not working. Hmm? Substance abuse. Substance abuse like alcohol, drugs, and alcohol. You're taking medications with substance, you're killing yourself. Risky behaviors like smoking with lung disease. Some people don't want to stop the bad behavior of smoking. These ones have met them. You have a lung disease, but you don't want to stop smoking. Who are you? Please, how can we help you to understand that you have a lung disease and we really need to help you to stop smoking? But if I don't smoke, I don't feel good. I just find myself smoking. Damn, you have a lung disease. Stop the cigar. Be healthy. You want to revisit the grave so soon? No. See, these are problems that a disease is affected by your psychological interpretation of some issues. Hmm? You have diabetes, but you are always eating starch and eating high sugar contents. My friend, a doctor tells you that you should use this as a nutritional guideline. Please use it as a nutritional guideline because this is where you are. Adjusting to this life may make you to be better faster or to have a complication. Adjust so that you be better faster and you live a good life. Hmm? When you go to, let me use HIV/AIDS, you go to a doctor, you say this is an immune problem. That if you take the ARVs, the antiretroviral drugs, they reduce the viral load and you'll be okay just like the other person and the other person who is not having this virus. But you are in denial, not taking the drugs. How can we help you? How? Psychological issues that are affecting the other condition that you are having. Somatic symptom disorders. We're talking about somatic symptom disorders. And you see, there are different somatic symptom disorders that we started by someone who is thinking that I am sick because I'm getting this symptom. And then we went to a person who thinks that these people are not telling me the truth. And now we are at a condition that your mental perceptions are affecting the conditions that you are having. Somatic symptom disorders. It is very important to understand that, yes, you may, like, for this happens mostly to women, or you get a child, a very beautiful child, but as this child grows, you understand that he's growing with a complication. And then you hide this child somewhere in the house so that people don't see it. You see it's wrong. Get out there, speak about this condition, let person A, B, C, D know about it. Whoever loves, let that person love because that person is not in his right state of mind. You will seek help and help will come. Your child or your person who has a complication will be helped to live a normal life. People that are deaf, they know how to speak, they go to school, and they do jobs, and they get jobs to government offices and other big offices. They have a disability, but they are working, earning a living. You get it? So, some things when doctors are telling you, you have this, find a second opinion. Good. You still getting the same result. Third opinion, still getting the same result. What are you waiting? Listen to the doctor. Stop smoking if you have a lung disease. Live a healthy life. Train yourself to stop alcohol. You have been told you have fat liver. You have a fatty liver, man. You stop drinking. Don't kill the liver so much because you think if you are the king of the bottle. You stop smoking. Smoking is not part of your body. Your body only receive food. Hmm? Very important. I've met these people. These are things that are real life. There are some people that smoking have made them go to their grave because you tell this person wherever you smoke, your sugar levels go up. You will take drugs up to the end and you're killing your organs. we call it end organ damage, and these people won't really listen to you. What do you do as a doctor? You advise, you advise, you advise. But this person will come with an end organ damage. Now you put this person on dialysis, still smoking. What does this person need? Killing himself slowly. Hmm? Maladaptive coping is always in this person, because when you tell these people the truth, yeah, they become angry. Why are you telling me that? Am I the only one? Our bodies are different, my friend. You may not have the immunity of like the other person that 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 was here, and that the last year or this year that is having smoking, but is still okay. So if you get yourself in a complication, don't say even person A, B, C, D had this and he didn't die. My friend, carry your baggage. Your fate was where you are. Stay positive with what you have. Hmm? Stay positive with what you have. Listen to the doctors. That was the problem that we found on a condition that is being triggered by psychological issues. You see, I'm going so slow. If you have a question, ask please. And then we have factious disorders. Marshall syndrome, factious syndrome. Now, hmm, physical symptoms to assume sick role. Physical symptoms that assume sick role. Have you ever met these people, my friends? Or I'm just talking and talking and talking of myself, myself. Hmm? Hmm? We have met these people in the family, but most of these people, you will find out that there is something that is making them avoid to do coming up with this so that they can avoid to do something. Hmm? They can avoid to go to school. They can avoid to do a job they did not meet up. They have not done their work well or homework, and so they are coming up with this. Hmm? So we are at the last one, factious syndrome, a mental disorder in which a person deliberately fabricates, exaggerates, or introduces physical or psychological symptoms in themselves or others to assume the sick role, not for external gain but for emotional gratification from being seen as ill or need for care. When you think people are not near you, you start faking some diseases or illnesses or saying that you're not okay. Hmm? You see, factious disorder imposed on self is one of them. There are two. And then we have factious disorder imposed on another. Hmm? Former Marshall syndrome by proxy. It is called by proxy. Now, let's go to A. Hmm? Factious syndrome. A. What is the criteria that you know this person is having factious disorder imposed on self, on him or herself? Falsification of physical or psychological signs or symptoms, or induction of injury or disease associated with identified deception. Hey, you just say that I'm sick, I'm not feeling well, my chest is always, and you're not here to help me. You see, that is like blackmail. Hmm? A mother who is the kids are so busy working out there, and then he starts saying she is sick so that the kids may come. Hmm? The deception, blackmail. The individual presents themselves to others as ill, impaired, or injured. He cannot even walk. This person is injured. Present. You see, if you see this, you'll know that this is. But you see, when you start to examine, you find out that this person is not really injured. The deceptive behavior is evident that in the absence of obvious external rewards like money. Hey, time of work. If sometimes you don't go visit the person, give some money or give some time, a girlfriend, a boyfriend, that is you've stayed a long time without seeing and then you start saying he's sick. You have not sent some money for this boyfriend of yours for some time. Start saying now you're not here, I'm not feeling okay, you don't care about me, but when you send some money, everything is okay. Hey, you know this is factious syndrome. Eh? Factious syndrome. The behavior is evident that the absence of obvious rewards time. Giving someone time when you are friends or relatives or a girlfriend, if you give this person time, you're rewarding this person. Because there are some people are so lonely, they don't have even a person to give them time to talk, to laugh, a personal friend to walk around with. So when you feel that this person that has been giving you this is not around because maybe that person is busy, you start feeling that there is a problem. Hmm? You start feeling that there is a problem and you fake diseases, fracture syndrome imposed on yourself. Sometimes you need money. Maybe the other person has not sent you some money for some time because maybe the budget is over his or her way. And then you start saying you're sick so that you can get the money. Hmm, Not good. If you see that, know that this one is a mental and psychological issue. It's not the syndrome. This person is not sick. The behavior is not best explained by any disorder. You see, this thing that the behavior is not explained by any disorder comes along every condition that is psychological. So you look at the person and you're not seeing any psychological issue. You know that no, there is a problem here. It's not a physical problem. It's not a somatic problem. This is a mental issue problem, my friend. How can we deal with it? Take this person for counseling. We will see about. We have not gone to management. Factious disorder imposed on the other, the B. We started with the A, imposed on self. Now we are imposed on the other. Same above, except the individual falsifies symptoms in another person. Yes, baby daddies, baby mamas, you say your child is sick. You have not come to see your child. Give the phone my child I speak to. Oh no 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 no. Even your own son and daughter. You maybe the father or the mother is away for working, very hardworking mother, trying to hustle hard, hardworking fathers also. And then you start having your partner calling every time that your son is sick. Please hand over my son, the phone to the son. No, no, you just come and see your son. Hmm? You have not centered anything. Please send. This is factious disorder imposed on another. Hmm? You present someone as ill so that you may gain something like time or money. You see, it's a form of abuse because when you lie, someone is sick and that person is not sick. You know it's abuse. Hmm? You want to focus on medical attention. That is abuse. You may go to court and you may have a problem. You see, symptoms here are faked and produced. Motivation. Motivation here is to assume the sick role. Send money or come and be with me. Send money for hospital. Send this for hospital or be with me. Awareness. The patient knows they are faking, but they may not understand why. You're faking, but you don't know why you are faking. Instead of telling this person the truth, please come have some time with me. Let's discuss why are you not gone for so long, man. I need you here. You just start faking things. You get it? External rewards. Hmm? Absent, distinguished from malingering. Hmm? In early adulthood and following hospitalization by health workers, this one is when this thing starts to manifest. But common behaviors here are manipulated by manipulating lab tests. adding blood to urine samples. Self-injury, injecting bacteria to cause infection. You inject yourself that to cause infection. You go to falsify medical records. Dramatic but inconsistent medical history. Yes, you see, frequent hospital visits here and there, always. Willingness to undergo unnecessary procedures. You see, but there are some red flags that you may see, like symptoms only appear when being observed. But when you are not with the doctor or a person, there is no symptom. Eagerness for eagerness for invasive procedures. You always want surgeries. Hmm? Extensive knowledge for medical terminology. Extensive knowledge. You have Googled, you have gone through all this and you know those terms. Numerous prior hospitalizations without clear diagnosis. You want to be hospitalized. You want to stay in a hospital and you don't have a diagnosis. These are red flags. History of working in healthcare settings. You want to associate yourself with histories. You've been working like a nurse, as a clinical officer, a doctor's assistant. You see, now we have talked about that. I think the best thing we can do right now is to know how to manage these problems because these problems are psychological. You see, these people, as we see them, they have problems, and these problems are psychological. So, how do we help from the first one, which is somatic symptom disorder? How do we help these people? Psychotherapy, cognitive behavior therapy is most effective. Psychotherapy help them to know how to deal with issues. Help these people to talk the truth. They are depressed because these issues end up to be depression. You get it? Antidepressants, serotonin inhibitors are important. Patient-centered care. You know they are sick. They are faking, but you know psychologically they are sick. Regular check them up. See single trusted physician, doctor that can help them cope and move from this bad behavior because they are not sick physically, but they are sick mentally. Focus on improving function, not chasing new tests or diagnosis. You focus on improving function, not always in hospitals to do some tests and some, yes, education. Educate them on what they should do. That is concerning symptom somatic. And then we have the second one that we talked about, illness, anxiety disorder. How do we go about illness, anxiety disorder? And you remember, we called it hypochondriasis. Yeah? Hypochondriasis. So how do we go? You will find that this person will always have cognitive behavioral therapy for help. It's the most effective treatment. Change of behavior. Let someone help this person change in behavior. Aims to change health related patterns and behavior. Very important. Help reduce reassurance seeking and avoidance behavior. Don't avoid people. Be given help and let this help be good to you. Hmm? So when you accept that I have this problem, you will be helped. And you see, because you are depressed with this, we'll give you some antidepressants. For people that have anxiety, we give them fluoxetine. And you remember how we talked how fluoxetine works. Regular reassurance for medical visits. Visit a doctor, visit a psychiatrist, a counselor to talk. Hmm? Conversion disorder, the one that we talked about, conversion disorder. How can we help people with conversion disorder? Neurological problems that cannot be explained by a doctor, but we think it is mental. How can we help this person? You psychoeducation, we're still going to psychoeducation, psychology, cognitive behavior therapy, address underlying emotional conflict, stress, or trauma. Teach coping skills. Teach coping skills. Hmm? Physical rehabilitation. Try to help them. to, to walk, to see, to look, treat comorbid like PTSD, anxiety, get to a doctor who can help these people to treat this anxiety related disorder. Psychological factors affecting other medical conditions. We have talked about when you have stress and then your sugar levels go up. When you have stress, your own issues is psychologically, and then your hypertension, your blood pressure goes up because you are hypertensive. Even if you take drug, what do we do? What do we do? Tell me, tell me what should we do? Cognitive behavior therapy is the key function here. Cognitive behavior therapy. Know how to relate, integrate care model, collaborate care between medical and mental health professionals. Because now you have a condition, you really need to have a doctor and a psychologist. Because now that you're taking some drugs, let's say for cancer or diabetes or hypertension, there is a professional that will help you in mental issues. And there is a professional who will be seeing you in the condition that you are having, like diabetes or hypertension. Very important. Hmm? Cognitive behavior therapy always comes in to help understand and manage harmful thoughts and behaviors. Because when you are exposing yourself on these issues, you may find yourself to getting problems. Hmm? And may be these problems may be we need you see when your sugar levels goes up, what will happen? Stroke is the next thing. So after stroke, ICU. So you need these two people. 12, a minute, I sign this. 12, so it's very important to be having this two. Nilete hiyo kodi ya nini? Hiyo niko nayo, sorry. Sorry. It's very important when you have this problem, you see these two people. You need a specialist who is helping you when it comes to matters mental health and when it comes to matters the problem that you are having. Now, if you have a question, you continue, you put it out, just put your question. Yeah? Psychoeducation is very important. There are some key features. That's why I said we will deal with management at the last time. So, just a minute, I do some. Yes,
Yes, correct.
for Alusi nimekuja nini?
Alusi.
Niliask for nine. Yes. Yeah. Let's see what's happening injection. Yes, sorry for that. Just a minute, I signed this document here. That's a man. Now we continue, my guys. Sorry about that. Now, we all this we have talked about. You see, there is a very important thing that comes in. There are three major things that are coming in integrated care model: cognitive behavior and therapy, and psychoeducation. So, please, when you have these problems, you see, there are problems that psychological, but they are bringing other problems. So when you're having this, please see a counselor, be treated, and you will be okay. So for today, we have talked about it. Tomorrow we'll have another topic, and I think everything will be okay. Now that I've not found any question, I log out. I I go and check the other patients that have come in. Being brought so many notes to see the patients. Thank you for everyone and the time you have given. Be blessed. One love.